when the whole PP started to become a thing, obviously we were like, we need to protect ourselves. And then what would happen is we just didn't have any. I remember like I was in A&E once and I came out of one room, I took my mask off because it was, dirty. I put it in the bin and I went to the nurse in charge and said, hey, can I have another mask? And she went, oh no, there's none left. You've got to keep the one you've got. People were kind of, taking a few masks, put in their pocket. But we were running out of everything, gloves, face masks, aprons, let alone the proper full PP that then came in much later when it was way too late. And I only realized actually how you're meant to wear PPE when I started teaching people for the Nightingale Hospital. Because what they then asked of us as doctors is, oh, on your days off, if you wouldn't mind going to teach at the Nightingale, at the Excel Centre, to train non-healthcare professionals to be able to then help in a healthcare setting when everyone got furloughed and stopped working. But also the bad thing about that period of time was we didn't have any guidelines for how to look after ourselves. So a lot of us doctors were getting fevers and we were getting unwell. So even we would be like, well, I'm not sick, but I don't feel well. And I definitely have a fever. Should I come into work? And obviously the answer was, well, if you can work, please bloody get into work because we need as much staff as we can get. And I think people felt really guilty not working, even though it was just not the right thing to do. And I think sometimes we didn't even realize we probably had COVID ourselves and were spreading it around the hospital, because what they try to do is isolate people on one ward and then leave obviously some wards COVID free. But the problem is you've got the same group of doctors going from one ward to the next without any PPE. And then so it really like hit home when you were like, I think we're the ones spreading it around the hospital, but we can't do anything about it.
If you're wondering where this clip came from, the link to the YouTube channel is in our bio.